complete honest, I didn't really know what OT was when I finished high school. I initially enrolled in a science degree actually, and quickly realised how much I hated chemistry. I always knew I always wanted to work in allied health because I like to help others and give back to the community, and OT seemed like the best fit. What really enticed me in this career was how holistic and client-centered our scope is, and as well as how varied our role can be, which gives you the option of where you want to work or specialise in. So this can include, the hospital sector, paediatric, occupational rehabilitation, mental health, and the community. In my current role, I work with predominantly home care packages, so with the elderly aged care sector, but also with the NDIS as well. We do a lot of comprehensive reviews, like functional reviews, just to see what, the barriers and limitations of the clients are, so that and also to improve their safety at home as well, so that, a lot of it is mainly around looking at equipment, so they help them at home, as well as modification and potentially therapy as well.
OTs are very busy, as Mary said, and they have waiting lists, and I have been lucky enough to be able to work with them, and they have been always very helpful. It is hard for somebody to get someone going to their homes to try to ask questions and not knowing why. So they can, and because they're elderly patients, sometimes they don't understand the purpose of the functional assessment. So Mary is pretty good at dealing with that kind of pressure.
I would usually explain to the clients that a functional assessment is for me to come in just to assess, to assess their home environment, but also to see how they do things on a day-to-day tasks at home. So it could be simple things as, seeing how they go on and off the bed, in and out of the shower, how they do personal care tasks, and getting to know their background, looking at see what the limitations are, and from there, trying to work with them to reach those goals. Astrid came out as well in one of the assessments, and we try to work closely with one another, and just to ensure that the appropriate services has been referred, and also making sure that he is safe at home, which is the most important part of our
And as Mary said, it's so important when you have a family that is supportive, because sometimes the situations get very complicated because everybody thinks differently, and if it's 4 or 5 people that have a say, and then we are there trying to suggest things that everybody thinks differently, and the actual client, the patient, is in the middle.
Education is so important, and I try to educate them on why this, a certain equipment or a certain modification is required, just to ensure for safety. And so one of my most enjoyable in my role is being able to celebrate wins, and also the impact it had, no matter how big or small it is. So it can be as simple as seeing a client buttoning their shirt for the first time, or having an entire bathroom modified to improve accessibility and enable them to the autonomy and dignity to complete personal care tasks. Sometimes I feel it's the everyday tasks that you and I may take for granted, how it can be a struggle or a long-term goal for an individual, and it's amazing that I get to play a small part in that journey and witness it.
I just tend to, now I believe that having an OT assessment is an asset for the client. There are things that we take for granted, and you can be at 70 and you can still do things, but you never know if at 72 you're able to do that. So having that initial assessment and maybe doing things to prevent falls knows that you don't want somebody to fall, and if you can prevent it, it means that the client can stay safe, independent at home for longer.
OT is a very, very holistic and client-centered career. It's definitely a very fulfilling career, I would say. So definitely go out, go out to like the universities and have a chat with the course coordinators and see if it's the right fit. It's very fulfilling. It can be stressful at times, I can say, but at the end of the day, I think it's one of the best careers because you get paid to help people out. I think that's you can't really beat that.
Yeah, absolutely.